Hello everyone. Thank you for coming to our presentation on rehab games in real-world clinical settings. I'm Hee-Tae Jung from UMass Amherst. Stroke is a leading cause of death and permanent impairments, which affect nearly 800,000 people every year in the United States alone. Many stroke survivors are left with permanent impairments that reduce their performance in the activities of daily living and the quality of life. Stroke survivors can improve and maintain their motor function through intensive and longitudinal rehab therapies. However, therapy exercises are highly repetitive, which lead to patients' poor engagement and recovery. To enhance the engagement of stroke survivors, the research and clinical communities have shown tremendous interest in employing games in rehab therapies. However, we still do not fully understand the real-world impact of using games in routine longitudinal rehab therapies. For instance, the game-induced engagement patterns of stroke patients, therapist roles and their perceived challenges are still poorly understood. In order to answer these questions, we went to an actual rehab hospital where rehab games had been employed in their routine rehab therapies for over 2 years. We conducted our study in 2 sequential stages. First, we observed 11 occupational rehab therapists to get a sense of interaction dynamics among therapists, patients, and games. Second, we interviewed 15 therapists to better understand patients' response patterns, how they affect therapist roles, and their challenges in more depth. As a result, we found 4 engagement patterns of stroke patients, namely attentive cooperators, misdirected gamers, inattentive bystanders, and old-fashioned enthusiasts. The first group, which we call attentive cooperators, work with their therapists to make the best out of game-assisted therapy sessions. These patients follow the lead of therapists and accept the games that therapists suggest. While enjoying rehab games, these patients also try to reflect therapist feedback on executing therapeutically more desirable movements. According to therapists, these patients are often in early stage of stroke, had moderate to mild motor impairment, and relatively good cognitive function. However, not all patients showed such desired responses. A group of patients that we call misdirected gamers is engaged with games mainly for entertainment rather than therapy. Misdirected gamers are often strongly opinionated about the games they want to play and even insist on playing the games that do not involve therapeutically beneficial movements for them. These patients do not tend to listen to therapist feedback. For instance, these patients would even shrug off therapist physical intervention and say, "I just want to do it the way I want." As a result, misdirected gamers often develop emotionally charged interactions with therapists and may not benefit from game-assisted therapy. The next group of patients, namely inattentive bystanders, does not engage in conventional nor game-assisted rehab therapies. For these patients, rehab games do not provide added motivation or merits. Some inattentive bystanders are in their late stage of stroke, have low expectation for recovery, and prefer massage over therapeutic exercises. In one video recorded therapy session, one patient spent most of the therapy time on receiving massage and did not execute any voluntary therapeutic movements throughout the entire session, even at the presence of rehab games. Some other inattentive bystanders are marked by severe cognitive impairments. These patients have difficulty understanding the rules of rehab games. Therapists said they usually remove inattentive bystanders from game-assisted therapy so that other patients can benefit from the limited hardware resource. While not observed in our video recordings, therapists stated that there are patients who are sufficiently motivated even without using games, which we call old-fashioned enthusiasts. Old-fashioned enthusiasts believe that they can make substantial recovery from conventional therapies and even prefer them over game-assisted therapies. Some of these patients were very sensitive to net exercise time and did not like the fact that part of their therapy session was spent on setting up rehab games. Some other patients thought rehab games are inappropriate for their dignity and game-assisted therapies are only for children, but not for them. According to therapists, some patients even say, "I want therapy, not game. I want to receive real therapy." In this presentation, we highlighted the 4 different engagement patterns that stroke patients show during the game-assisted therapies in the actual clinical setting. If you want to know more on therapist roles and their perceived challenges, please read our paper published in Tokai. Thank you for your time and attention.